Hello, good morning, good afternoon, good evening. This is Dharam Singh, your host for this special webinar. And my guest today is Jayson. Jayson is in Brisbane. He works in the hospital system, and we will talk more about what he has learned and what he has done, especially in the COVID time. So Brisbane is part of if you don't know, it's Australia, in Australia. And I know Brisbane very well. I spent a lot of time in Australia. Uh, Recently moved to the US, but currently I am in Sydney, in Australia. And this is temporary. I will be back in United States next week. So, I requested Jayson, look, you have great experience, and would you like to share your knowledge with the people around the world? So he kindly accepted my invite. So thank you, Jayson. Thank you and welcome.
Thank you very much for the opportunity today, Dharam. Much appreciated.
Yeah. So the good thing is that Jayson was my student, PfMP student. He did PfMP Portfolio Manager Professional on 16th of November. And he passed with a target result. He can talk about his journey, and I'm very excited to say he is my 76th, I think, so far I've 76 PfMPs, and all of them with above targets. So thank you, Jayson, for helping me to maintain my above target result.
Thank you, Dharam.
Yeah, so I'm very excited the way the journey is going with a lot of people. They come join, very uncertain to start with, but gradually when they start doing the application, they start feeling confident and getting ready for the exam. 7 days, 8 days before we have a meeting, and nervousness. But that meeting itself is very powerful, and then you go all the way and pass it. Good. So look, Jayson is coming with his portfolio program project management with 15 years, more than 15 years experience, working in various industries. Especially, you worked in health, currently you're in health. You worked in human services, defense, and security organizations. So you work in the complex commercial government and government organization. So you are working in a leadership role, and you have been providing support into the project management program and the portfolio management to the organization. So the current organization you're working is MATA, is that correct?
Yeah, MATA Health Services. So we're a Catholic not-for-profit organisation. We provide public and private health services across the state of Queensland. We have about 8 acute hospitals, some in North Queensland in Townsville, some in Cairns, some in Mackay, and then Southeast Queensland we've got a number of sites. So geographical challenges, and obviously at the moment we're part of helping the state government respond to vaccination, COVID and things like that. So very, very busy times for health.
Indeed, indeed. And the good thing is that you guys are helping so many people, and we cannot underestimate the contribution made by the hospitals, doctors, and the system. And it's not only the people in front line, but the back end people, the IT people, which I think your team has done a good job there as well. So exceptional work. So thank you for helping in the difficult time. So yeah, please continue your services and let us wave out of this, the difficult time of COVID. Hopefully, next few months or actually, I don't want to say few years, but a few months, we should see the mask-free life.
Yeah, it's certainly creating some headwinds for the delivery of projects, and just for context, my portfolio is the digital portfolio for MATA, so very much focused on the ICT systems. And as we discussed today, I'll make some links to how we are directly making a difference to make our clinicians' lives easier and therefore benefit our patients. So it's meaningful work and a great culture to be part of at the moment.
Exactly, and you get excited. You're making some contributions to the life, people's life, and that's an exciting and motivation factor.
Yes.
Yeah, thank you. So other than PgMP PfMP he recently did, he's a PMP, and you did MSP practitioner, Prince 2, CCPM, and many other certification and qualification you have. So yeah, I mean, it will be exciting to listen to you and the way what you did and the application part. You have many things you're going to learn today. So thank you all for joining today's session. As usual, we have done many webinars, and the people who have exceptional skills and experience, I invite them to the session, and they come to this session. They share openly and give the country knowledge bank. So my aim is to build a knowledge bank, in the form of videos from various experts, and hopefully you will be benefiting from this, and your generations and future generations can also benefit from this. So that's the whole idea. So having hundreds of videos and listening to the people who have made the difference in people's lives. So once again, thank you all for joining. And I know it can be very late in the night. Sometimes some people joining very early in the morning. But that is what your dedication. That's what your dedication shown in this way. So with no further delay, I will be asking several questions to Jayson. The format we agreed upon, and some of the questions Jayson already has seen. So he has prepared his answers, and we will be opening. The floor is open for you guys as well. So whenever you feel something you'd like to ask, please ask. Don't keep it to yourself, and I will be asking your questions whenever is the right time to ask. We may be able to take a question during the conversation, or if I feel that they should be taken at a later time, I'll be taking that. So yeah, so we'll try to cover as many questions as we can. If we cannot cover all the questions, we'll come back to you with our responses later on. The focus is not about PfMP here. Focus is about the experience Jayson has and what he can contribute. But I will request to Jayson to at a later time talk about few minutes about his journey at PfMP, what made him to decide to go for PfMP rather than PgMP, and what was the journey, what he did, and all kind of things. All right. So guys, please feel free to ask questions, and at later time I will be sharing the PDU code. Hopefully that will give you, not hopefully, that will give you one PDU, free PDU. And the people who's watching this webinar, you can request for the PDU once you have watched this whole webinar. So please send me email, or if you're watching YouTube, you can put a comment there so I can provide you the code by email. Perfect, great. So anything else, Jayson, you'd like to share before we get started?
Oh no, that's fine, Dharam. Thanks very much for that very complete introduction. Yeah, very keen to share my knowledge today, and I hope it benefits people on the call and beyond that.
Perfect, great. Thank you once again. So let me start with my questions. And the question is, to what extent has the Australian health sector, because you are coming from the health sector, Australian health sector embraced the projectized versus functional delivery approach? And how does this help you? And how are we getting the results from this?
Yeah, I think largely health is very aware of the benefits that a projectised approach brings from middle management layers right through to executives and boards. Obviously, health is dealing with finite resources and finite time and needs to prioritise those resources. So they're very experienced in projectised approaches for their larger system implementations, things like back-end HR systems, finance systems, and larger clinical care systems. I think it's like any business, it's careful about how we apply and where we apply project management. Health has a vast array of very experienced managers who are able to deliver results outside of a projectised approach. So balancing and respecting where the projectised approach is needed as opposed to the BAU balance as well. So we try to make sure that we're listening to the healthcare executive where they need a projectised approach and where perhaps they don't need our time. So we're very respectful of that. I guess health is a very collaborative approach. We need to make sure that we've got a range of IT experts, clinical experts, and also our consumers. We consult with them. So that's where a projectised approach helps us with that type of work. Where we're seeing positive results from our organisation, where we're gaining a lot of traction with our executives, is the projectised approach allows us to scale and deliver consistent results. So we started the portfolio at MARTA probably 4 years ago, and we've matured that each year. What we were at there was we were delivering about 20, 25 projects a year. We're now delivering 40 to 50 projects a year. So we've been able to scale based on best practice project, program, and portfolio management. So that's where we're seeing a lot of traction. And what's making a big difference there is we're very outcome focused, and we've arranged things in logical programs. So we're then able to get multi-year projects running. So that's where we're seeing more consistent outcomes.
Yeah, some people, they will not understand the projectized versus functional approach.
Yeah, okay, yeah. So yeah, if we look at that projectised approach, where we have a clear planning, time to plan, time to design, test and release, as opposed to a functional manager who may have a team in that BAU type example. For example, in an emergency department, we may need to make a rapid change to the way we process patients. And that may mean that we do some back-end system changes to help with that. Our BAU teams are very capable of doing that. For instance, we've just had to change some of the way our wards are laid out to deal with patients. So our functional managers made that decision, they made that happen, and our BAU IT people were able to make the changes in the system. So they didn't need a project to do that. They were actually able to respond quicker to that, I guess, that crisis. And they didn't need us to come in with the necessary overhead of a project for something that might have been a system upgrade, for example. They were able to do that themselves. So, yeah.
I mean, again, it depends on the type of work you're doing. You take that approach. Yeah. So
that's right. And we very much encourage, as part of our handover of the project, is we try to embed that capability. So there's a lot of BAU capacity to respond to. You know, in health, there's multi-trauma crises. There's COVID is the example we'll keep going to today because it's front of mind. But they've got to be able to respond to those things without the need to then go and dial up a project and the time frame that comes with getting people on board for a project. So it's great to see. We partner very well with our BAU people.
Perfect. Great. Thank you very much. Thank you. All right, moving to the next question. How have you, at the matter, experienced the COVID pandemic affecting and shaping the organization? So we're going through this tough time, COVID, and it's actually impacting every organization, especially the health organization. So how it has impacted, positively and negatively?
Yeah, I think the projectised approaches have really allowed us to respond to COVID. So we've got a lot of multi-year programs that are running at the moment. Things like addressing technical debt, rolling out new end user devices, rolling out technology like the technology we're using today, video conferencing and things like that. So we had a plan to address that need, but we were able to reprioritise where we were spending our resources to respond to COVID. So we had crisis management teams that had older technology that wouldn't allow them to work asynchronously across collaborative tools. Those teams didn't have video conferencing technologies available to them. Because we had that program in place and those projects in place, we were able to rapidly reprioritise where those projects were focused to respond and get the tools in the hands of the people that needed them. So we planned to do that a little later, but we were able to pivot and respond to COVID by getting those tools in place. So that didn't mean that we departed from good project management process. We retrospectively applied necessary change requests and the things, but we were able to pivot at pace and keep to good project process as well. So I think the pandemic has shaped the priorities for the projects. It's definitely shaped the types of projects we're doing, but it hasn't disrupted our overall strategic plan. Like, we always had a strategic plan to get teleconferencing, telemedicine in place. If anything, it's actually accelerated, and we've seen an easier adoption pathway, because our end users actually understand the benefit acutely in this time as to what it can do. So, I've seen a few memes around as you see your chief information officer or COVID driving your IT strategy. Well, thankfully, we had an IT strategy that we were able to accelerate to help us respond to COVID, and it's probably about where we spend our time on those projects. So that's allowed us to really shape and respond to COVID in our organisation.
And that does not mean you're cutting corners or breaking the processes.
No, it doesn't. In fact, it actually means that we've got to make sure that with the finite funding that we have, that we've got it appropriately prioritised and focused on the right things. And I guess, thankfully, because we had those mature processes in place, we're also able to have to keep a really pleasant culture in our organisation of other people who we haven't discarded their need or their benefit, but we've been able to show them that that's now sitting in outer years, because we've had to do and prioritise some of the COVID response. They still know that their initiative is important, and they understand why it might have been given a lower priority in the context of what we're dealing with. So I guess that's helped us with good stakeholder management and keeping the trust with our organisation.
Perfect. Great stuff. Thank you very much. Guys, you have a question to ask questions, so whenever you feel like, please put your question on the question pad. All right, moving to my next question, and this is interesting. So how well do the senior executive manager, manage the epochal shift in the healthcare sector due to the disruptive nature during the pandemic?
Yeah, I think if we think about why we've been able to rapidly deploy technology, it's because our executive are quite clear, and they understand and they embrace new innovation. So I guess if we sort of deal with that question in 3 key points as to why we've been able to keep going at pace with executive support is, in times like this, it's important that we're clear and concise in our communication, and we don't confuse staff. So there's a lot of top-down communication happening, and I'll touch on why that works in a moment. That's one point. I think the second point would be that we have good governance controls in place, and we have access to rapid decision making. So that's been critical to our portfolio and our projects being able to run at pace, is that our executives are very active and they're great sponsorship. And the third point is that we've been able to resource teams and resource wisely with our executive supports. They understand that we may have to get specialists in to work more rapidly, and that may come at a higher cost, but they understand that would work more rapidly. So I think about top-down communication. Our exec are very wise. They consult through our governance groups. They consult with the frontline management teams, and we have a forum where we check our messaging with our frontline managers that it's actually going to provide clarity for our staff before we send that top-down message. So we often see a lot of adjusting there. So that clear and concise communication has been really, really key to responding to the pandemic, because the last thing we need is different comms and frustrations and confusion with staff. So keeping everyone aligned for clear comms. I think governance is really, it's been key for us. We've got quite mature steering committees per project. We have a mature investment decision-making group, and where we've had to recalibrate our prioritisation processes and our prioritisation categories, we already had the group in place to have those conversations with. So good governance has actually helped us control and respond in a controlled manner to the pandemic. And I think lastly is just the fact that our executive is so close to our projects and they're quite hands-on, which has pros and cons, mainly pros. And they've been able to understand the type of resourcing we've needed to respond. So we haven't had to do a lot of re-justification to get the right team members and the right equipment at the right time.
Perfect. Very nice. Okay, good. All right, so I have next question. So what strategies are adopted by the healthcare organization to overcome resource shortage and skill deficiency?
Yeah, I think the human resource shortage, if I talk about human resources, there are other resource shortages in terms of availability of IT systems just due to shortages in supply chain. But I'll just talk to human resources for a moment. I guess what the strategies that we've approached, and I would say that it doesn't solve the problem, but it helps de-risk the problem, but it doesn't remove it. I guess it's the fact that we have a good culture and we've communicated to our existing people that they have confidence that they have ongoing meaningful work. And meaningful work is at the heart of why people come to health. So we really focus on why are people here, why do people want to be part of health. It's hard work, but it's meaningful work. So I think that's one thing, is making sure that the existing staff aren't leaving and that they're well cared for. And that culture is probably the second point, is that the teams are aware of how they're contributing to the COVID response. We have a culture of care, of family first, of just good employer of choice type arrangements. We're very focused on that. And the other thing is we realise we can't do all of this ourselves. We don't try to do all of this ourselves. We're very focused on long-term partnerships with the right organisations who align to that culture. And naturally, at this time, broader global IT organisations are drawn to really try and help. And it's been amazing, some of the response we've had from some of the larger global vendors understanding, prioritising some of those resource shortages around IT equipment, prioritising it to the health sector. They've been quite wonderful. So I think, again, and then the reality is, even having said all of that, we've still got resource shortages. So again, it comes back to prioritising right work, right time type frameworks, and understanding that some things are taking longer while other things are prioritised.
Yeah, I mean, especially this time when, because of COVID, resources are constrained, people used to travel, or they can't travel anymore, and you don't get the devices, material on time, and other shortage is also going on. So
yeah, and to expand, we have IT team members who have APRA certification, and APRA is the Australian body that certifies people to do their clinical work. So we have nurses who are also very experienced in IT. They're actually going out and doing frontline shifts. So those people they've been taken off our IT projects and they're doing meaningful frontline shifts. So those resources are being used in the best place they can be used in. So I don't know whether it's a resource shortage or just people are doing the right work in the right place, and that's not IT work. And that's okay. We understand that as an organisation.
Yeah, that's a revitalization. And that you can handle when you have a system which can say, okay, these are my resources, these are my work given, as we learn in the PfMP, supply demand, we manage the supply demand, which is the utilization of resources, the most efficient way, where they could add most value. And
yeah, it's a very mature conversation, and obviously, we have times where we're disappointed that we couldn't do some work that we had planned, and perhaps the recipient of that work is understandably frustrated, but we're having those conversations as a mature group of adults, understanding the context we're operating in, brings control, and lets us keep focused on what matters.
Exactly. Great stuff. All right, thank you. My next question for you is, how can embracing agile help in improving healthcare delivery? Agile is becoming buzzword everywhere you see agile. So I'm sure it has touched the healthcare system as well. So how it is helping? Not helping.
Yeah, agile helps us a lot. For us, we're probably more experienced at traditional project management methodologies within our organisation, although we are embracing a product management approach and an agile approach. So overall, we're a hybrid delivery model, but so to stay away from sort of pure agile versus the traditional agile conversation, where I see agile practices helping us is things like stand-ups leading to collaborative work. Where we're able to be more agile is where we take mature platforms, and I think the term in IT is platformization. For example, workflow tools like ServiceNow, Dynamics 365, Microsoft CRM tool, we're able to use those tools to quickly change the workflow. May have been an IT service ticket, but we've used that same workflow to quickly come up with surgical workflows of helping our public system respond to surgical wait lists. The actual core is no different. So where we've got a mature product, we're able to be agile. Some of our projects that we do don't lend themselves to agile. So, for instance, some of our medical management systems, they must go live holistically and they must be right from the start, so they need a more conservative approach. But where agile helps us is with our more mature products. And we also find that sometimes our clinicians don't have time to be in that product management mode until we've gone live with the first release of a product. So we do that through a traditional approach. But once it's live and they see the benefits, they get quite actively involved in a backlog of things for improvement. So we're probably more agile in our enhancement space than starting new projects.
Okay, great stuff. Okay, thank you very much. And moving on to the next question. So the question is, has the shift to online, omnichannel engagement, and the tokenization during COVID-19 changed customers' perspective of the healthcare? About healthcare?
Yeah, I guess the example that I'll use here is telemedicine. And definitely where we're seeing, we were always ready technically to do telemedicine. There were a number of barriers to telemedicine that have been broken down. So legislative barriers were preventing us from using these omni-channel methods. So, for example, the billing of a physical patient turning up for an appointment was well understood legislatively, but telemedicine, the billing system wasn't in place. So that was preventing some of the private specialists engaging in that. With COVID, those legislations have changed rapidly. Another example is prescriptions for medicine needed to be in Australia. The legislation was that those prescriptions had to be physically signed and original documents. With COVID, that legislation has been relaxed and we're able to email those prescriptions. So I think the omni-channel and the technology has always been there, but the compliance and legislative framework has not lent itself to allow that to be used. Whereas now we're seeing that, and we're seeing fantastic advances because those legislative frameworks have been removed. For example, we've just got a hospital in the home application that we've released, which is letting well COVID patients, so those that are lower levels of symptoms or asymptomatic, be cared for in the home, which is helping manage not flooding our acute hospitals. So we're able to use devices like the Apple Watches to input into a survey system, and our clinicians are calling these people twice a day on the phone to make sure they're well and not deteriorating, which is making sure that they're not clogging up the hospital system. So that's where we've been able to and obviously our consumers are very open to that type of care. We're also seeing advanced care in cancer care, where patients are able to receive their care in the home, and our clinicians have mobile devices to go out and do that care, as opposed to that they have the personal preference now as to whether they'd like to come to the acute hospital and have that care, or whether they'd like to experience that care in their home. So that really means that we're really caring for the health consumer and giving them some more options about where they're treated and how they're treated, which when they're in those sort of times in their lives, it's a very respectful experience for them, and it's driven by their preferences. So we've got multiple channels of service, which is being enabled through digital transformation, and that's further enabled by legislative transformation. So all of those things are coming together quite nicely at the moment.
Yeah, I think it's actually in a good side, good way to see that. Because just give you an example, yesterday only, we had our appointment with a specialist for my son. And because of this technology we are using at the moment, my doctor is in Sydney, I'm in Sydney, my son in Sydney, my wife is in California. We all can attend, we can ask questions, and we can take notes. Normally when we see doctors, we just listen and 15, 20 minutes. We spend one full hour and talking, and we talk various topics, not just specific to the topic. So this is not available when you walk to the care hospital and then wait there in the queue, and then you also have a chance of getting other diseases. And
I think that's a perfect example, because although that patient is that person experiencing the care is the centre of everybody's priorities, the family support that is available there is huge. Like, I guess if you're experiencing as the patient, you're unwell, and COVID example, it does impact the cognitive ability to process information. So having a family member available on that teleconference call can then allow that family member to hear and support more afterwards, and a direct understanding, as opposed to the poor patient then having to explain it to their family. So yeah, that holistic care of the family being part of that care is a great example. It's where that technology is, and then we're breaking down those geographical barriers as well. So we're finding, in Queensland, there's an expense of a regional person having to travel several hundred kilometres for care. We're trying to, maybe they've got to do that for their first appointment, but the checkup appointments could be done through a telemedicine thing. So we're saving them that family, that cost of travel, the fact that maybe the parent of the child doesn't have to take time off work. It's less impact on the family. So yeah, that consumer experience is not just the patient, it's that whole family support mechanism. So yeah, agree with your example, Dharam. It's a great one.
And it's actually, that opens up, servicing other communities, which you mentioned, regional community, where it's very difficult to, especially Australia, a country like Australia. We have a lot of population living somewhere in the middle of Australia, sending somebody, and that's a very costly, plus a lot of time goes into this, but yes, with this way, with having this kind of mechanism, it's actually blessing for the hospital system.
Yeah, I think it's quite like those more traditional IT projects, like replacing the network, replacing the end user devices, they then have a whole new meaning that stick to that sort of omnichannel, or that the base technology, the base network has to be in place. It has to be right. The ability for good internet services, good Wi-Fi services, all of those sort of basic IT projects take on a whole new meaning when you can see the direct benefits that they're giving. So that, I think, again, back to that staff shortage question, those people that are working on our network upgrades, they understand that what they're doing is creating experiences like what we've just spoken about. So it's meaningful work. Yeah.
Okay, very good. Thank you. Okay, my next question is how to achieve digital transformation during integration to maximize value creation in a healthcare organization?
Yeah, I guess we've sort of spoken about why digital transformation has a lot of meaning there with some of those examples that we've used. So it's not hard to see why digital transformation creates patient benefit, but we also have digital transformation going on in our back-end systems as well. So our billing systems are being improved, which again gives her a better consumer experience. So through digital transformation, we're enabling more channels of services for patients, as we've discussed. And we're also making our healthcare organisation more efficient with better HR billing systems in the back end, which means that our administrative staff can be focused on more meaningful duties by sort of streamlining those back end systems. So again, it's not hard to see why having an efficient finance system is important and contributing to patient care. So digital transformation, and we have a multi-year strategy around digital transformation, which started with just dealing with our technical debt, as I touched on, and making sure that our basic systems were right. And then we're now at sort of year 4 of that journey. We're now getting into those smarter systems that we're able to use. So I think that's the value that digital transformation is creating. More channels of services for patients in the telemedicine space. We've still got a long way to go. A lot of health is still on paper, surprisingly, but yeah, we continue to work on that.
Right. I do have a question from the audience, which was sent to us earlier. We read it out. This is about the government organization. Government organizations tend to be over-regulated. Processes such as procurement in many cases are inflexible, and instead of aiding the organization, hindered by prolonged needs-seeking efforts. COVID aggregates this. Any lesson learned? So,
yeah, I think, like I'll address the question as procurement and in a government context, because I think that's the question is procurement in a government context. So for me, you're spending public money to start with, so it's understandable that there are there's a heavy overhead of compliance with spending that public money. So it's just good critical path management, isn't it? Like if you know that procurement is the long path in a government department, then it's something we need to be aware of up front. I think the benefits of good procurement management are firm, understood contracts in place, especially if we're dealing with external partners. So we're coming from a common understanding where we understand what our body of work is, what their body of work is, and we have a chance for a successful partnership. We've all executed projects with poor contracts and gotten into those nightmares. So procurement overall delivers value. In government departments, because of that overhead, if you take a program or portfolio approach, rather than trying to do individual procurement per project, you can start to work on things like standing offer arrangements, which you can then leverage across multiple projects. So while those things will take longer to put in place than just trying to do a procurement piece for an individual project, if you've got your portfolio and your program strategy right, you can start to do some smarter procurement, which gives you mechanisms you can leverage. So while your first 12 months of your program, you may be setting those things up and it may slow that 12 months, then moving on, if you've got a standing offer arrangement in place or a broader agreement that you can leverage across multiple projects, that will save you time in the long run. But yeah, I think it's just recognising that there are some things on our projects in government that are on that critical path and create that long path. And it's also working with our stakeholders who may be doing their first project and they haven't experienced the procurement process that is mandated, and it is a compliance element of working in government. The longer you start trying to get around it, the longer your project's going to take. You need to enter into it and understand it. And the other the other tip I can give, so standing offer arrangements, holistic, and the other tip is probably making sure that you understand that you've got procurement people on your project team that are prioritised to your project team, and that they're category specialists. So in our area, we have medical supply procurement specialists. We call them the medical category. And we have an IT category manager who works within our portfolio. So we've actually built a little procurement team within our portfolio. They actually report, they still have separation of duty, and they still report through to the procurement team overall, that they're functionally reporting to them. And that separation of duty provides confidence to executive that they're making the right decisions. So even in the private sector organisations, we've got to provide confidence that we're getting value for money. So having that procurement team as part of our portfolio has helped us accelerate things. So yeah, it's I think if you see the value of procurement and the value of good contract management, good vendor management, and approach it that way as opposed to an inconvenience. That's my advice.
Yeah, so there can be sometimes unnecessary processes which is stopping or delaying the much needed equipment or devices. So that I think that organization should look into whether the process we have is adding value, or maybe it's putting you just back. And one thing you mentioned correctly that this is the taxpayers' money. So yes, your money, whatever you have, it has to be utilized very effectively. In the meantime, you don't take too much time in the whole administration, which is also wasting the money of the taxpayers.
That's right. Yeah.
Take the project itself with the taxpayers' waste of money. So I think that's where organization has to take another view. Hey, what are adding to the organization, not to the taxpayers' money?
Yeah, that's it. I think it's just the lessons that have been learned over many years of being transparent in the way we spend taxpayers' money. So yeah, and that comes with benefit.
I'll give one example. I was working for New South Wales government, and one person was so rigid with a very small change. And every time you give an example of taxpayer money, and that project got delayed by 3 months. And that the change was not big enough. The government was very insignificant. But the 3 months of the delay was a huge thing compared to that. So,
and I find what we've been able to do by investing time with a good relationship with our procurement department is often our procurement people are advising us of more efficient processes and more efficient pathways to be compliant. So we're now coming to them with this is the outcome we need to achieve. We've got a time pressure. They're able to help us navigate the process. So I guess we've employed the right specialists on critical path activities. And that relationship takes time to build. So it's worth investing in. Yeah.
Exactly. Very nice. Just for the audience, I will share the post identifier for your PDU. So please check your chat. And I also put a link to the YouTube where I have gone through all about PfMP, what to do with PfMP and all those things. So please copy and paste that link and use it, watch it, and also come back to me for any questions, clarification. And if you need any guidance, of course, you can put some time with me. I'll be happy to give you some guidance. And you can be celebrating your PfMP just like Jayson is doing. So, look, it's a difficult exam, but if you have a proper plan, proper structure, you cannot go wrong. So, after having 76 above target results, 100%, I cannot ask more than that. So this actually brings me to the question, if I can ask you, if you can spend some time about your PfMP. Some people like to know or learn from you, why you decided to do PfMP and what was the PfMP journey? If you can briefly tell us about that.
Yeah, I'm very thankful again for your mentorship through the PfMP process. I think if I speak to it in terms of a logical way, what attracted me to it was, I guess, the PMP and project management certifications. Those best practices give us a frame of reference when we're executing, and we're adapting and adopting them. We're not applying them blindly, as we all know. But having that frame of reference to come back to helps. I'm very lucky to be the portfolio manager for the digital program at Marta, and got some very clever finance people I work with as well, who are partnering with us to do that. So I just felt it was the right time for me, that I had the experience in planning multi-year investments. It was the right time to go and formalise that knowledge. And I guess the PMI certifications demand that experience, so that genuine certifications. I felt I had the experience to undertake the qualification. And it's definitely given me some great language that I'm able to connect instantly. Even the side of doing the exam, just the discipline of the exam leads to intense study, but the language of inventory of work that's been adopted within our organisation now. We understand that there's a selection of work that may be done. We understand the process better. So it's allowed me to communicate a lot more clearly, and also communicate more clearly with my program managers about why things change and how things change, because I think it can be very frustrating as a project manager or program manager to see things change that you've worked really hard on. So I'm able to communicate with them a lot more clearly about how we're making change. So that appealed to me about the PfMP qualification. And then if I sort of talk to the assistance that I got from yourself, Dharam, was the application process is quite intense, and having your assistance to shape that application up. I mean, I got through the application process quickly the first time, and given that it's a submission process, an acceptance process, and then an assessment process, it's weeks of time that it takes. So I wouldn't want to have failed in getting that through quickly. So I think that was good to get through efficiently. And then, of course, just trying to, the pressure of holding to your 100% pass mark, I took quite some points.
Actually, yeah, some people do get the pressure. Hey, I will pass the exam, but I will show that I don't want the first person to break that record. I don't mean to put any pressure like that, but yes. I mean, I think the way we prepare for the exam, that makes you, without putting too much effort in there, but you yourself is there.
You go along with
thinking. So the confidence is already built to you, and you just very good with the exam, you execute your plans and whatever you learn throughout the process.
Yeah, no, it's definitely definitely the way to. It made it a much more enjoyable process.
Exactly. So look, I mean, it's 76 now. I'm looking for next 24 PfMPs with our target. I like to see if I can reach all the way 100. Beyond that as well, will I get anything out of that? Not really, but it's just a self-satisfaction to see that my students are not only passing the exam, but getting above target results. That's a very satisfaction to me.
And I think if we can have a common language across industries that we're all working to as well, it means that we can deliver value more quickly to our customers and their consumers. So that common language that we're able to, when we're trying to form teams up to deliver projects, if we're all coming off a common framework and common language, we can get to a point of performing or high performance quicker. So that's hopeful that the more people who have this knowledge, the quicker we can perform at pace.
And a lot of advantage, you can transition yourself from one organization to another organization, one country to another country, because people in this country, other country also understand the same language, very easy to transition.
Definitely.
So I don't see this certificate just for the name of certificate. It's more about learning process. How can I be better program manager, better portfolio manager, better project manager? to do my job better, efficiently, and with improved productivity, with having a team which is highly motivated and delivering the expected results. That's what should be the aim for any of the certification, and I think you learn a lot in this whole process, and you deliver not only your PfMP but also your language and a lot of value add you have created for the organization, which is exactly.
Yeah, definitely.
All right. Anything else you'd like to add to the journey, or anything else?
I concur with your thoughts. It's about just self-improvement and then sharing that self-improvement with your team, and mentoring and passing that knowledge on. As we get more and more experience, it's I guess it's altruistic that you get a lot of reward from helping someone else advance in their career and seeing your team grow, and whether those people grow within your team or you see them fly off to other organisations and rise through those organisations, it's equally rewarding. So it's just nice to be contributing to that overall overall skill set that we all need to do these challenging projects that we have on our plates.
Thank you. Yeah, no, thank you. And I mean, what you mentioned is a self-satisfaction as a teacher, as a mentor. And when somebody goes through journey and difficulty and all kind of, especially COVID time, when you pass the exam, you are excited. I know everybody, when you go through the journey, you're excited, but it's giving me equal or more excitement that, hey, another of my student, and not only pass the PGM, but is he even able to take the organization to the next step because of the learning you got from this kind of programs. So thank you for trusting me on the journey. I know it's not easy to, there's so many people around the world, they can be teaching, but you've shown the trust, and you took me as a mentor and gone all the way and give me one more reason.
Thank you.
So guys, I don't have any other questions from you from my side, and if you have any last minute question, please put that. And I have shared the PDU code for you. And if you want to reach out to me, I think Jayson is also okay if you want to send a LinkedIn message or LinkedIn invite. You can connect with him, or you can always reach out to me via LinkedIn, or maybe book a meeting with me and talk to me, whatever you deal with, just PgMP, PfMP, or any other certificate, or anything you like to do. I mean, nothing to do with certificate, just want to talk to somebody, especially in the COVID time, you don't have anybody to talk to, you can always book some time. If you book the time, that's your time, 15 minutes or half an hour is given to you, no matter what you talk to me. Okay? So please take care of yourself and your family, and we are going through a tough time. Nobody has expected this long journey of the COVID, but we're still going through that, and I'm sure we'll be out of this very soon. But you need to stay mentally, physically, emotionally in control, and everything will be just, it will be history very, very soon. So thank you very much to all the people who joined today, and thank you, Jayson, for delivering this exceptional presentation and talking. And thank you very much.